Hi, my name is Dr. Amir. Have you ever known a patient who had diabetes for many years, that lost vision or even had a foot amputated, or started on dialysis for kidney failure? All these are related to the serious complications of having uncontrolled diabetes for 15 to 20 years or longer, especially in obese or heavy smokers, or patients with other conditions like high blood pressure or cholesterol. An example of acute complications of diabetes is hypoglycemia, which is an abnormal low blood glucose below 70 milligrams. Most of the time is caused by diabetes treatment, like taking high dose of insulin injection or taking diabetic pills when they did not eat enough food, or they delayed eating meals, or exercised more than usual. The symptoms of hypoglycemia are sweating, dizziness, fatigue, and shaking. In severe cases, when the glucose level drops below 30 milligrams, patients show symptoms of confusion, fainting, or even seizure, which is a very serious condition. Treatment for mild cases is easy by taking sweet drinks like orange juice. But in severe cases, it is an emergency, which requires rapid glucose in the vein. One of the serious chronic complications is either brain strokes or heart attacks. They happen because of a blockage in a small artery in the brain that causes paralysis in one of the extremities or abnormal speech. And if the blockage happens in the heart, it can cause damage in the heart muscles, causing heart attack, or even can cause a sudden death. Diabetics are recommended to seek an evaluation from a cardiologist to screen for potential heart problem, especially for patients who also have other risk factors, like heavy smoking or have high blood pressure or cholesterol. Another complication of diabetes is the bad effects on the eyes, especially the retina, leading to blurry vision, bleeding inside the eyes, and eventually blindness. It is also recommended for every diabetic patient to have a yearly eye exam by an ophthalmologist. If the retina is affected, then it can be treated with laser to save the vision. Prolonged diabetes can affect the kidneys. At the beginning, it can cause the protein to leak from the blood into the urine. This is normally reabsorbed by the body. And this can be discovered with a simple urine test. So if this condition is treated early, it can prevent developing into kidney failure, which would mean, if it happened, lifelong dialysis and kidney transplant to treat it. It is recommended to do a periodic blood and a urine test every 3 months to detect this complication early. Moreover, diabetes can affect the circulation and the nerves, especially in the feet, causing tingling and numbness, as well as decreased sensation in the skin. Also, decreased blood flow to the legs can cause pain while walking, and foot ulcers, which on the long term, if it was not treated, it can lead to gangrene. This is a very dangerous complication, which might need amputation to treat it. To prevent this, doctors should examine the legs and feet periodically, checking for the skin sensation as well as the feet pulses for the circulation. Finally, I wanted to explain these dangerous complications not to scare you, but just to highlight that patients should control their blood glucose level around normal, which is 100 milligrams, and keep diabetes under excellent control. And how can we do that? Is by maintaining the hemoglobin A1C test around 6.5%. This can be achieved by taking the medications regularly, adhering to a strict diet, exercising regularly, and most importantly, losing weight. If they do all of these, then most likely they can avoid these horrible complications and live a normal life. I hope you enjoyed my topic today. To stay up to date with my latest video, you can subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.